Hello, health lovers. So it's your cute student nurse V, and today on health episode, I'm going to be talking about gastroparesis. So one of my main reasons of choosing this topic to talk about is because many people are suffering from bloating, poor digestion, and also heartburn. Maybe during eating food, they have very slow digestion and they get full easily. Now, one of the main causes of these problems is gastroparesis. So what is gastroparesis? So gastroparesis is a condition that's a digestive disorder whereby the stomach does not empty the food quickly into the small intestine, so it could slow the digestion of that food. Now you may ask, what are the common causes of this gastroparesis? So one of the common causes of gastroparesis is nerve damage. So if you have a damaged nerve that controls the churning of food in the stomach, it can lead to gastroparesis. So the nerve that is responsible for the churning of food in the stomach is the vagus nerve. So if you have a damage in your vagus nerves, then you could have a condition called gastroparesis. Now, moving forward, we talk about diabetics. So gastroparesis is more common in people that consume high intake of sugar. So people that are diabetic and also hyperglycemic, they have the tendency of developing gastroparesis. Now, another cause of gastroparesis is medications. So certain medications like antidepressants and narcotic drugs, narcotic drugs can lead to having the condition called gastroparesis. Now, moving forward, we'll talk about unknown causes. So many people can develop gastroparesis without any reason, and this is called an idiopathic gastroparesis. There's no reason for having that. Now, talk about the symptoms. What are the signs and symptoms? If you are feeling those signs and symptoms, you need to go and check yourself because you might be having gastroparesis. So one of the signs and symptoms is bloating. A little food that you eat, you bloat. Then poor digestion. You feel full easily and you can't even, your body can't digest that food immediately. Then we also have nausea and vomiting. Imagine eating a food and the next thing you're feeling irritated and trying to vomit. So that is the symptoms of gastroparesis. And we also have poor appetite. Yes, you want to eat, but you can't just eat. Yes, you can't just eat it. You feel full, but you're not eating. That is a symptom of gastroparesis. And we also have malnutrition, because if you're not eating properly, you'll be malnourished, you lose weight. You also have weight loss because you're going to lose weight. You're going to lose weight drastically, and it's going to look as if you are going to lose weight because you're not having the adequate nutrition your body needs, the adequate nutrients your body needs. You're not having it because you can't even eat it because of too much bloating. And this bloating, remember, the cause of this bloating is what? Gastroparesis. So moving forward, we are going to be talking about the diagnosis for gastroparesis. So how do we diagnose people that have gastroparesis? So we have gastric emptying of the stomach. So the patient is going to be fed a very safe radioactive substance, and this radioactive substance is going to visualize, it's going to act like a camera to visualize and scan how the stomach empties the food into the small intestine. That is the first way to diagnose if a person has gastroparesis. Now, another way to diagnose this gastroparesis is through medical history taking and physical examination. So when we are taking history from the patient, we are going to know if the patient is having bloating, or the patient will be like, oh, when I'm eating, I vomit. Those symptoms like that, we get them during history taking. Then physical examination by using our eyes and also our other senses. We use our eyes to see if the patient is malnourished. We also palpate the patient. We do deep palpation in the patient to check the mass of the stomach. Then we also do percussion, checking we also do percussion in the abdominal region. And what is the reason of doing this percussion? To check for the dullness, the resonance, and the tympathy of the abdominal region. Then also we conduct auscultation. So auscultation is the use of our stethoscope to observe, to check out the patient's organs. So using physical examination, we can also diagnose gastroparesis. So another way to diagnose gastroparesis is ultrascan. Yes, ultrascan. And the last way to diagnose gastroparesis is upper endoscopy. So endoscopy is a tube that has a camera. It has a camera and is being inserted into the cavity. It visualizes how the organ is working, if the organ is working perfectly. So the dangers and complications of gastroparesis: number one, malnutrition. If you're not treating that symptom you are facing now, that symptom that might be showing you that you're having gastroparesis, you may have malnutrition. Another one is uncontrolled blood sugar. That means you will be having diabetes. you'll be having diabetes mellitus. So that is another danger and complication of gastroparesis. Now, another danger and complication of gastroparesis is dehydration, because you're vomiting too much. When you're eating, you're vomiting, and that thing you're vomiting is containing liquid. So at that point, you are getting dehydrated. So there are so many complications that is resulting from gastroparesis if not treated, or if not diagnosed earlier. So what are the management of gastroparesis? Anyways, gastroparesis is not treated but can be managed. So how do you manage gastroparesis? Number one, the kind of food you're going to eat should be soft or liquid. It should be in a soft or liquid form, so you know the kind of food you're eating. So number two, you take very small intake of food. You know your tummy, you know your belly, your stomach doesn't accept much quantity. It's having a problem in moving it into the small intestine. So what you are putting in there should be little. You should not overfeed. The another one is that know the way you take sugar, because sugar is one of the things that can lead to a complication of gastroparesis. So know how to take sugar. Now, another management for gastroparesis is medication. You take medications, you go for regular checkup, take medications that will aid in emptying the bowels. You can also take things like cathartics. Cathartics helps to induce defecation. And lastly, avoid fatty food. Yes, your fat intake should be minimum. So you avoid anything that has to do with fats, all those junks. Avoid all of them. Avoid fatty foods, because it's not going to help your condition at all. So when you're diagnosed with gastroparesis, if you're watching this video and you're having those symptoms, please go and check if you have gastroparesis, and make sure you manage it on time, because if you don't manage your gastroparesis, it might lead to you having an incision in your small intestine, and you'll be taking fluid into your body. You can't even eat again because the condition has gotten worse. So please go for proper checkup and know if you have this condition. And if you have it, please stay away from fatty food, stay away from sugar. It's not going to help your condition. Okay, now I'm going to end this video by saying healthy lifestyle and avoiding sugar is the key way of managing gastroparesis. That is the key way. So thank you very much for watching my video. Do well to like, share and subscribe to my YouTube channel, and I'm going to be posting more health talks here. Thank you. Bye.